Okay, another angry at the healthcare system video. If you're the caregiver for an aging parent and they're in a short-term rehab facility and you're finding the communication is horrible, you're going to want to hear today's video. We're going to talk about what I think is going on, and then at the end of the video, I'm going to give a strategy on how we can try to work around this ridiculousness and to help you to get more information, because information can be very powerful in helping you to advocate for your parent. Because if we don't get the information, we can't help them. So I'm going to start by talking a little bit about how historically insurance paid for hospital stays and rehab stays until recently, the last couple of years. So before the last couple of years, when someone went into the hospital, they were billed, or the insurance company was billed, based on what was provided, what procedures were done, the equipment that was used, the supplies that were used. And then more recently, in the last couple of years, the payment structure has changed. So the way that hospitals are paid now is per episode of care based on a diagnosis. So, for example, if somebody goes in to the hospital with a heart attack, the insurance companies have figured out that based on a specific diagnosis and the person's age, and I think they're supposed to take in other diagnoses into account too, that this episode of care should cost this amount of money. So that's the amount of money that the hospital is given. But what I'm seeing from my perspective working in healthcare is that this is often leading to people not getting care. So what happens is somebody goes into the hospital, the hospital's given this lump sum of money, and if they can get this person out of the hospital really quickly, they can keep any of that excess money that they didn't spend on the patient. You see how this could cause some problems. So I understand where Medicare came from, that there was probably a lot of things that were being done that weren't necessary. There was probably a lot of overspending being done at hospitals. But from my perspective, I see it a little differently. I see a lot of people coming from the hospital having only one thing addressed, and they might have multiple things going on. And we see them coming to rehab much sicker than they used to be. And I would be willing to bet that the amount of hospital readmissions from a short-term rehab facility are way higher than they used to be because of these things. So I have a story that I want to share. And after the story, we'll talk about a strategy to advocate for your parent if they're ever in a situation like this. I had a patient who was 80. She had broken her hip and laid on the floor at her home for 3 days. One of the medical things that can happen when somebody isn't moving for that period of time is something called rhabdomyolysis. Long word that basically means the muscle starts to break down and it sends chemicals into your system and your organs get affected, and it can be a medical emergency. So because this person laid on the floor for 3 days, she had medical issues that had to be resolved before she could come to our facility. But when she fell and broke her hip, it was after having had a hip fracture last year that didn't heal right. So the hip was basically disintegrating. There's another big word for that. And so the hip was disintegrating. It disintegrated enough that it broke when she went to step on that leg, and it kind of crumbled into pieces. The long bone got shoved up kind of into her pelvis. Very painful thing that happens. And it used to be that this would be treated by a hip replacement, which is pretty much the only treatment at the hospital if someone showed up with that kind of an injury in the past. In this particular case, it was very interesting to me as I read through the documentation before I saw this person that the hospital wrote that when they talked to the patient and her family member, that they didn't want any surgical intervention to fix this hip. And I thought that that was really strange because this 80-year-old woman was independent, living independently at home, was walking with a walker. She was really active, going out with people and shopping and doing all of those types of things. So it seemed strange to me that she would have chosen to not have any surgical intervention done. So when I asked the patient, she had no idea what I was talking about related to the hip. So I called her daughter and I brought up the word for the crumbling hip, which is avascular necrosis. And the daughter said they didn't talk about that at the hospital at all. They were just worried about the muscle breakdown issue that she had. So I asked her some questions. They didn't bring it up and they didn't talk about surgery to fix it. And she said no. And so my thought, and I could be totally wrong, is that the hospital maybe gets paid more for the rhabdomyolysis the muscle breaking down thing, than they do for the hip thing. And again, I could be totally wrong, just my perspective. But what all of this resulted in is us educating the patient and her family, and then helping them to push for this woman to get seen by an orthopedic surgeon. And it took a month for her to get the surgery to fix that hip. That's a month where she was basically bedbound. At 80 years old, it's not easy to be bedbound for a month. And it's so unfair to her, somebody who was independent and very vibrant before this. And I see similar things to this happen all the time. So the biggest thing that I can recommend is, as soon as your parent goes into a short-term rehab facility, that you ask for all the paperwork from the hospital. Hopefully you have somebody who can understand what it says. But if you can't, ask somebody at the facility. Ask a nurse, ask one of the therapy staff. They should be able to help you to understand what some of the words are. Because waiting a month to get a hip fixed that in the past would have been fixed immediately when she was at the hospital is not something that any of our elderly population should have to go through. Hopefully today's video was helpful and I wasn't too angry. If it was helpful, please like and share. Add any comments in the comment section below. Subscribe to my channel, and thank you.